Hey guys, it's me, Todd. I'm back in Chicago. I've been here for about a month now. Sorry I haven't really been able to upload any videos, but after I got back here, as you know, I had a heart attack in Thailand. And when I got back here, I had to check myself into the hospital. I checked myself into a hospital called James Franciscan Hospital in Olympia, Illinois. We'll try to put a picture up there to show you what it looks like. Worst experience I ever had. I mean, they really messed me up. They changed all my medications, and I was in nothing but pain for the past 4 months. And for the past month, I couldn't do nothing. So I went back to my doctors, which were at the University of Chicago. And everyone knows in Chicago that the two best hospitals are the University of Chicago and Northwestern. And all they did was just switch me back to my medications I got back from Thailand. So the quality of care I got in Thailand was top notch. Number one, it was great care, and you can't beat it. And then I got back here and went to one of the local hospitals, and they just really messed me up. So this video is not about the quality of care I got in Thailand, but it's about money and finance, and the finances. All right? So we're going to talk about two things in this video. One is going to be about international health insurance, and the second one is going to be about the Thailand Health Fund for foreigners. If you're a foreigner and you're in Thailand and it's an emergency and you go to the hospital and you don't have the money or your insurance won't cover it like mine did, then what happens is the hospital itself will apply to the Thai government, and they have an international health fund that will cover your whole bill. And if I'd known that, I wouldn't have given them so much damn money. But here's the problem. When I was at the hospital, I just had my heart attack, 4 days later, and I was lightheaded, dizzy. I couldn't even really stand up to take a whiz without any help. And they kept coming to my room in the morning, then in the afternoon, afternoon. They asked me to keep calling my insurance company, right? And I could barely move. I could barely sign my name. I mean, they could help me out, but they wanted me to do all the work. And so I felt that they were taking complete advantage of my ass, kept pushing me. And I had to call my insurance company and figure everything out by myself. So I had an advocate, or like a wife or a girlfriend or a brother, they could have done it for me, and they would have been there also to help give me a lot more protection. Because I was there by myself, I felt I was completely taken advantage of. So when I found out from calling up my insurance agency that they wasn't going to cover the bill, I had to cover it out of my own pocket. And they didn't tell me that the Thai government would actually cover the bill if I didn't pay. So I gave them the wrong debit card. I have a lot of debit cards. My Charles Schwab debit card looks just like my Capital One credit card, right? So I gave them the wrong damn card, and that's the reason why they were able to drain my whole account. Like I said, I was incoherent. I wasn't completely thinking straight at the time. I couldn't really protect myself fully. And then at the same time, they kept asking me questions all over the place, like, what do I do for a living? You got $24,000 in the bank to get your visa. Why can't you use that money to pay us? A whole bunch of other stuff. Ask me questions over and over again. Like, what about family members and everything else? They can pay the bill. And they kept doing that for 3 days over and over and over again until I called my insurance, found out my insurance was crap and wouldn't cover it. So my point is that if you're in Thailand and there's an emergency, they will have an emergency fund that will cover the whole bill for you, so you don't have to worry about paying that much out of pocket. All right? Number two is, when you give them your debit card, make sure your debit card does not have a limit, like $2,000 limit, like I had on my other debit cards. So they can't get so much money out of you. Then after I paid them, and I found out that the Thai government is going to cover the bill, they still came in the next morning, asking for $500 more. Trying to get as much money out of me as they possibly could. Then before I left the hospital, they said, well, sign this paperwork to say that you make monthly payments. So I signed paperwork just to get the hell out of there. But now I'm in America. There's no way I'm gonna make any payments. I thought I was completely taken advantage of. Because they knew I was sick and I couldn't. And they knew I was sick. They knew I was vulnerable, and they kept coming to the room in the morning, at night, in the morning, afternoon for like 3 days straight until I gave them some money. Then the next day they kept doing the same damn thing, asked me to call my insurance company up and all the other bunch of crap. Here in the United States, you give them your insurance card and they take care of it. They take care of all of it. Now the doctors, they were great. The doctor speaks English, but a lot of nurses don't. And even the nurses who don't, they've been doing this stuff for so long, they know exactly what you need. So you don't have to worry about the language barrier whenever you're in Thailand's hospital. And the hospital I was at was called Bangkok Hospital, and they have locations all over Thailand. So I was in Phuket at the time, but they have locations in Phuket, Hue An, Bangkok, Pattaya, all over Thailand. And they're supposed to be one of the best hospitals in Thailand. So the quality of care was number one, number great, top notch. Came back here, Franciscan James in Olympia Field messed me up so bad I couldn't even walk for like a whole month. I had to use I got a walker, put it that way. I'm now back to the point where I can walk. I can't stand for too long while being in a lot of pain, but at least I can walk. And all the doctors did, now my old doctors he'll be able to go back to, all they did was just put me on the same medication that I had in Thailand, and that cleared up a lot of my problems. Right? So like I said, the quality of care in Thailand is great. Now, however, if I had my heart attack when I was in the Philippines, I'll probably be dead. But that's another story. And now let me get into the international health insurance. Okay, I did my research, found out that Britain has a lot of protections for consumers when it comes to buying insurance. But I found out the hard way after being in Thailand that those protections are only for British citizens. If you're not a British citizen, they can sell you any type of shit policy, and that's what happened to me. So when I was researching different policies, I decided to go with them because if I went with the insurance in Thailand from their websites, from the Thai government website, you had to pay for the whole thing all up front. Well, 1 year of premiums all at one time. So that would have been $2,500 all at once. And plus, I couldn't find one that would cover me in other countries. I could have gone with Safety Wing, but Safety Wings, I needed a special type of verification. And Safety Wing will not give me that verification. But the other one from Britain, the sales agent said, well, he can give me the verification or the signature that I need. So that's why I went with the other guy and said it was Safety Wing. And I should have gone with Safety Wing. Safety Wing has a great reputation, but even the hospitals in other countries, like in the Philippines and Thailand, knows Safety Wing. All right, they have worked with them in the past, so everyone knows that Safety Wing knows the company Safety Wing and have a great reputation within Asia. All right. So I went with the British insurance. Found out later on that was shit. Okay, now, so I pretty much was scammed. But I don't feel bad about being scammed because one, when you're a good, decent person, our minds don't think that way. Our minds don't think about how someone is scamming us because our minds think about if you're a good person, someone else is probably going to be halfway or decently good. And plus, when it comes to, I'm 60 years old, and I know there were scammers. They've been working on the scam since they've been in high school. That's where they start out. And then when they're in the early 20s, they find a scam that seems to work for them. And as the saying goes, you don't change, you just get better at the game. And that's what they do. They've been working on the same scam, perfecting it, so by the time they reach 30, they have it down pat. So they can answer all of your questions, diffuse all of your concerns, and they're able to scam you and get money out of you. And that's what they do. The second thing they do is they just try to use someone else's credentials or someone else's credibility. For example, Mother Teresa or the Pope. If I'm a scammer, I can get a picture with Mother Teresa or the Pope and put it on my website, or say that they recommended me, then that means more people is going to trust me because I'm using their reputation, their credentials, in order to scam more people. So I may not have healthy credentials, or I might have the reputation, but I can use somebody else's. And I can say, well, they trust me, you should trust me too. And that's what happened to me. There's a YouTube channel called Vagabond Buddha, great channel. His information is almost 100% correct. And he even said that he switched over from Safety Wing to using this guy. So I decided to try this guy out. And when I did, I called him up. He's in the Dominican Republic, Alex Ross. And he answered all my concerns. He had his thing down pat. In fact, I need to email Vagabond Buddha and let him know that his insurance may not even work in any country. And that's why I bought the insurance policy. Well, anyway, the insurance policy basically says that if you had any type of pre-existing condition for the last 5 years, you're not covered for nothing. So you had high blood pressure, diabetes, hypertension, cancer, you're not going to be covered for not a damn thing if you had it for the last 5 years. Alex Ross told me for the last 2 years, so I thought I would be covered for most things. But he said no. And since everything is related, even if you only had diabetes but did not have high blood pressure or hypertension, you're still not going to be covered because all of it is related. So what he says for the last 5 years, no pre-existing condition and nothing that can be related to any pre-existing condition. And all of it is related. We had cancer, high blood pressure, hypertension, diabetes. All of it is related. So the only thing that cannot be related is like you get a specialty disease or a broken bone. Other than that, you're not going to be covered for nothing. All right? And that's what happened to me. Right, because I had cancer, but it was 5 years ago. Anyway. So, my best advice is to just buy Safety Wing. I mean, there's another company called Cigna, and Cigna is an old company within the United States, and they could be good. However, with Cigna, they're going through an insurance agency, and their international insurance, health insurance, is not in the United States, it's in another country, it's somewhere in Europe. So I cannot say it's Sigma if you have any real protection when it comes to buying insurance through Cigna International branch. So I would just go with Safety Wing. A lot of the hospitals within Thailand know Safety Wing, and some of them also in the Philippines, in the Philippine capital, which I forgot what it's called, not Cebu, but the other one. They know Safety Wing too. So just go with Safety Wing. And the great thing about Safety Wing is, when you talk to them, you're not dealing with an insurance agent, you're actually dealing with Safety Wing directly. And that's one of the best parts. Okay, so I think I covered everything. Oh yeah, don't forget to subscribe. Subscribe, because remember, I want to buy a boat. And I want to do a video as to why I want to buy a boat. But to sum it up is, one, when I was in Thailand, I was out in the middle of the ocean, fresh, clean air all over the place, like an hour outside, all of my health problems just vanished. Then I got back to shore and they all came back. Plus, living on a boat is a great lifestyle. I mean, the cost to live on a boat for 2 people for a middle-class American lifestyle is about $1,500 a month. And that is no matter where you live. You live in the Caribbean, Tahiti, Fiji, Europe, it's the same cost. Because you're basically carrying your house with you, making your own water and your own electricity. Now, when I get into that video, I'll talk a lot more details. I'll give you examples. But that's really the way to go. All right? So, that's about it. Remember to subscribe. I need subscribers so I can build up my YouTube channel so I can one day hopefully buy a boat and just sail around the Caribbean. Okay, thanks. Adios.